Hello everybody. We welcome you to our YouTube channel, Equation by Pharmacist Moms. In this video, the topic that we will discuss is the prescription. We will start learning with history of prescription. The concept of prescription dates to the commencement of history. So long as there were medicines and a writing approach to obtain directions for preparation and use, there were prescriptions. Modern-day prescriptions are in fact extemporaneous prescriptions. The word extemporaneous is derived from the Latin word extempore, meaning at or from the time. It means that the prescription is written right away for a certain patient with a particular condition. This is differentiated from a non-extemporaneous prescription, that is a generic recipe for a common illness. Contemporary prescriptions developed with a split of the role of the pharmacists from that of the physician. These days, the phrase extemporaneous prescriptions are earmarked for compound prescriptions that involves the pharmacist to mix or compound the medicine in the pharmacy for the specialized needs of the patient. Where did the Rx symbol come from? Generally seen on doctors' prescription pads and signs in pharmacies, Rx is the symbol for a medical prescription. But from where did the Rx symbol come from? As per most informants, Rx is derived from the Latin word recipe, meaning to prepare. The second theory, as to the origin of the Rx symbol, lies in Greco-Roman culture. This dispute spins around the symbol for the Roman mythological deity Jupiter, which Roman physicians may have often written on medical prescriptions. It is probable that this practice was passed down from Roman physicians to European physicians, and that Jupiter's symbol had metamorphosed into the Rx symbol by the mid-times. There are two justifications for why Roman physicians would have written Jupiter's symbol on their prescriptions. The first is that Roman physicians would habitually offer a prayer to Jupiter, requesting for protection over their patient. To reduce this process, these doctors began writing the symbol for Mercury on their prescriptions at various times. The second explanation is that during the 1st century, Roman physicians would write Jupiter's symbol on medical papers, including prescriptions, to express their support of Roman religion. Both of these reasons are believable, and may even both be true to some extent. Among numerous other theories, however, it is the faith that the Rx symbol is developed from the Eye of Horus, who was an ancient Egyptian symbol associated with healing powers. Within Egyptian mythology, the god Horus lost his eye to an attack from Seth, an evil deity. However, Horus' mother used her mythological power to restore his eye, and as such, the Eye of Horus served as a symbol of healing and protection in ancient Egypt. Physicians would use amulets of the eye in their medical rituals, and both the living and the dead would wear these amulets for protection. It is also probable that all three of these symbols were used separately, and their sameness is only coincidental. If this was the case, the Rx symbol would be a tradition, passed down only from the Middle Ages. However, these characters, in fact, affected each other. Now, we will discuss prescription in detail. The word prescription is a combination of two words, pre meaning before and script meaning writing, or written. It implies to the actuality that the prescription is an order that must be written down before a compound drug can be made. Prescriptions are often simply called scripts by people in the industry. Prescription is a form of instruction that is used by a registered physician or healthcare practitioner to govern the healthcare plan for an individual patient. For a prescription to be recognized as a legal medical prescription, it requires to be filed by a qualified dentist, herbalist, advanced practice nurse, pharmacist, physician, psychiatrist, veterinarian, etc. The medication prescribed should be within their scope of practice to prescribe such remedies. This is irrespective of whether the prescription incorporates controlled substances or over-the-counter treatments. What are the parts of prescription? Let's discuss. In the United States, the layout of a prescription falls into 7 components. However, with contemporary prescribing practices, some of these are no longer relevant or incorporated on routine basis. First one is date. Date is the important part of any prescription because it can control the use of the drug, especially for the narcotics and controlled drugs, and it also helps in the next follow-up. Second is patient's information. This part consists of patient's details, name, age, sex, and address, to avoid any medication error. Third is superscription. This part means the sign Rx, which stands for the word recipe, meaning to take in Latin. Fourth is inscription. This part contains the name of the medicine, its strength, frequency, and dosage form of the medicine, to be dispensed by the pharmacist. Next one is subscription. It includes the dispensing instructions for the pharmacist. The instructions could be regarding the flavor of the medicine, any particular label, and quantity to be dispensed, that is, for 1 week, etc. Sixth one is signa. This part is about the directions to the patient that how the medicine should be taken. For instance, the method of administration or application, the time of administration or application, the diluents, for example, water, if relevant, or means of application, for example, brush, and the part of the body where the preparation is to be applied in case of external use. Last one is prescriber details. It includes the information of a prescriber or practitioner, his name, signature, and address. Some states, drug categories, and patient groups require supplementary information on the prescription, such as various prescriptions will indicate whether and how many repeats or refills are permitted. It means that whether the patient may get more of the same medication without getting a new prescription from the medical practitioner. Regulations may limit some types of drugs from being refilled. Prescriptions in the U.S., every so often, have a label box. When checked, the pharmacist is directed to label the medication and provide information about the prescription, in addition to provision of instructions on taking the medication. Else, the patient is just given the instructions. A few prescribers additionally notify the patient and pharmacist by giving the indication for the medication, that is, what is being treated. This helps the pharmacist in checking for errors, as several common medicines can be used for multiple ailments. Several brand-name drugs have cheaper generic drug substitutes that are biochemically and therapeutically equivalent. Prescription could also contain the directions if generic form of the drug is allowed by the prescriber as a substitute. Drug Enforcement Agency number is a distinctive identifier that comprises of 2 letters, 6 numbers, and 1 check digit. It is assigned to the healthcare provider, including doctor, nurse practitioner, dentist, or veterinarian, and it allows them to write prescriptions for controlled substances. In some states, it may be a legal requirement to include the age of child on the pediatric prescription. It is advised to include the age of the child if the patient is less than 12, and the age and months if less than 5. Adding up the weight of the child is also supportive. For a prescription for a controlled substance to be considered valid, it must be issued by a legitimate medical purpose by a registered practitioner, acting in the usual course of sound professional practice. Registered practitioner refers to any healthcare professional who is authorized to prescribe controlled substances within area in which he or she is licensed to practice and who is registered with Drug Enforcement Agency, that is DEA, or is exempt from registration. According to Federal Controlled Substances Act for controlled substances prescriptions, these must be included in prescription for controlled substances. Issue date. Name and address of patient. Name, address, and DE or registration number of practitioner. Drug name. Strength of drug. Dosage form. Quantity prescribed. Directions for use. Refills, if authorized, and manual signature of the prescriber. Always remember, as per Federal Controlled Substances Act, Schedule II prescriptions must be presented to the pharmacy in written form and signed by the prescriber. A prescription for a Schedule II medication may be phoned into the pharmacy in an emergency situation. The prescriber must follow up the phone prescription with a written prescription to the pharmacy within 7 days. Fax Schedule II prescriptions are generally permitted, however, the pharmacist must receive the original, signed written prescription before dispensing the Schedule II controlled substances to the patient. Prescription for Schedule III to V controlled substances may be written, orally communicated, or faxed to the pharmacy. Schedule II medications may not be refilled, and a new prescription must be written every time. Medications classified as Schedule III or IV controlled substances may be refilled up to 5 times in a 6-month period. Schedule V medications may be refilled as authorized by the practitioner. Sometimes prescriptions are used for the substances that are not strictly regulated as prescriptions. It may occur if drug benefit plans may reimburse the patient only if over-the-counter medication is taken under the direction of medical practitioner, or if the prescriber asks the patient if he or she wants a prescription for over-the-counter medication or want to buy it themselves. To avoid the confusion with prescription, the physician may give the medication name to the patient on blank piece of paper. Certain prescription devices are also mentioned on the prescription, such as dental cements, various prostheses, gut sutures, sickle cell tests, etc. Compounded prescription, which is also known as extemporaneous prescription, is an order that requires mixing of one or more ingredient, that is, active medicament, with one or more pharmaceutical necessities, including vehicle or suspending agent. The physician selects the drug, doses, and desired pharmaceutical dosage form, and the medication is prepared by the pharmacist accordingly. National or local, that is, state or provincial legislation regulates who can write a prescription. In the United States, physicians, either MD, DO, or DPM, have the widest prescriptive power. All 50 states, and the District of Columbia, allow licensed certified physician assistants, or PAs, to write prescriptions. In some states, there are limitations for controlled substances. All 50 states, and the District of Columbia, Puerto Rico, and Guam, permit registered certified nurse practitioners, and other advanced practice registered nurses, for instance certified nurse midwives, to write prescription. In few states, limitations exist for controlled substances. Several other healthcare professions also have prescription writing authority associated with their domain of practice. Veterinarians and dentists have prescribing control in all 50 states and the District of Columbia. Clinical pharmacists are permissible to prescribe in some states through the usage of a drug formulary or collaboration agreements. In Florida, pharmacists can write prescriptions for a restricted set of drugs. In all states, optometrists prescribe medications to treat specific eye diseases. They also issue spectacle and contact lens prescriptions for corrective eyewear. Numerous states have passed our XP legislation, which allow clinical psychologists, that are PhDs or PsyDs, to prescribe drugs to treat emotional and mental disorders. They are registered as medical psychologists and have also undergone specific training in script writing. Chiropractors may be able to write a prescription, dependent on scope of practice laws in a state. In United Kingdom, in 2000, pharmacists and nurses were given authority to dispense emergency contraception under a physician-signed prescribing protocol. But this supplementary prescribing was not enough, as the prescriber needed to address the whole patient. For example, pharmacists could treat a patient for asthma with a steroid inhaler, but if the patient is suffering from chronic pain and had diabetes, pharmacists could not prescribe for these conditions. In August 2013, legislative alterations in the UK authorized physiotherapists and podiatrists to have autonomous prescribing rights for approved medicines that are used to treat ailments within their own area of proficiency and competency. Traditionally in Canada, the authority to prescribe medicines rested with a small number of professions. In the past years, changes in legislations and regulations in most Canadian provinces allow the pharmacist to initiate, continue, or modify drug therapy, ranging from renewing a continued care prescription to independent prescriptive authority. Doctor's handwriting is a character reference to the stereotypically scribbled handwriting of some medical practitioners, which at times causes mistreatment. In the U.S., unreadable handwriting has been obliquely liable for at least 7,000 deaths annually. Numerous devices have been designed to electronically read the handwriting of doctors, including electronic character recognition, keyword spotters, and post-processing approaches. However, the continuing swing to electronic health records and electronic prescriptions may lessen the requirement for handwritten prescriptions entirely. Over the years, many conventions have been developed for prescription writing to avoid doubts or misinterpretation. These include careful use of decimal points. Avoid unnecessary decimal points. For example, 5 milliliters should be written instead of 5.0 milliliters to avoid possible misinterpretation of 5.0 as 50. Always use zero prefix decimals. For example, 0.5 should be written instead of 0.5 to avoid misinterpretation of 0.5 as 5. Avoid trailing zeros on decimals. For example, 0.5 should be written instead of 0.50 or 0.50 to avoid misinterpretation of 0.50 as 50. Write milliliter instead of cc or cubic centimeter. Although they are technically equivalent, but to avoid misinterpretation of C as 0 or the common medical abbreviation for with, the Latin cum, which is written as a C with a bar above the letter. Further, CC could be misinterpreted as C. C, which is a seldom used abbreviation for take with meals, the Latin cum cibo. Directions should be written out in full English, although some common Latin abbreviations are also used by many physicians. For example, 1 cap POQIDPCHS will be interpreted by the pharmacist as take 1 capsule by mouth 4 times a day, after meals and at bedtimes. Quantities should be given directly, or implied by the frequency and duration of the directions. Where the directions are as needed, the quantity should always be mentioned. Where feasible, usage directions should specify times, such as 7 a.m., 3 p.m., 11 p.m., rather than simply frequency, such as 3 times a day, and particularly correlation of orally consumed medications to meals. Permanent ink should be used. Avoid using units such as teaspoons or tablespoons. Write out numbers as words and numerals. For example, dispense number 30 is written in a bank draft or check. Avoid apothecary or avoirdupois units and symbols. The use of apothecary or avoirdupois units and symbols of measure, such as pints, ounces, grams, scruples, grains, and minims, is discouraged, as they may cause confusion. For example, the abbreviation for a grain, that is GR, can be confused with the gram, abbreviated G. The symbol for minims, which looks nearly same to an M, can be mistaken with micrograms, or meters. Likewise, the symbols for ounce and dram can simply be confused with the numeral 3. Similarly, the symbol for pint can be easily read as a 0. Due to the possibility for inaccuracies, metric equivalents should always be applied. Avoid using degree symbol. The degree symbol, which is frequently used as an abbreviation for hours, for example Q2 to 4 degrees for every 2 to 4 hours, should not be used, since it can be confused with a 0. Further then, the use of the degree symbol for primary, secondary, and tertiary is opposed, since these could be confused with quantities that are 10, 20, and 30, respectively. Micrograms are abbreviated as mcg, rather than μg, as it could easily be mistaken for milligrams if handwritten. Therapeutic purpose should be included in the subscription to prevent errors in dispensing, such as for control of blood pressure. For example, the use of losartan for the treatment of hypertension may requires 100 mg per day or 1.4 mg per kilogram per day. On the other hand, for the treatment of congestive heart failure, the dose of this angiotensin II receptor antagonist usually should not go above 50 mg per day. It will also assist the patients in organizing and understanding their medications. Patient weight should be included on the prescription to avoid dosing errors, especially when drugs are administered to children. What is an e-prescription? Healthcare professionals, who started their practices well before the dawn, than those who were raised when world was already online, have a distinct viewpoint regarding the complex communication and sensitive information about the patients. Electronic prescriptions are modern-day computerized adaptation of old-fashioned paper prescriptions. A traditional paper prescription relies on the physician's individualized prescription pad for security to avoid counterfeit prescriptions, as well as protection of blank prescriptions by the staff. After receiving the signed prescription by the patient, it is taken over to the pharmacy by him or her. Before receiving the medication, the patient has to wait for undetermined period of time, dependent upon how busy the pharmacy is. On the other hand, e-prescription uses computer-based security instead of paper prescription pad. The prescription is signed electronically by the physician, and then it is sent immediately to the patient's preferred pharmacy by the staff. How does an e-prescription work? Most contemporary medical practices use electronic health record or EHR software to computerize all patient files. After the physician or nurse finishes examination of the patient, he or she types the medication into EHR. Here, history of patient's medication is seen instantly, including fact, as if the patient has allergy to any particular drug. An office can use e-prescriptions as an individual module or as a part of a fully integrated EHR system, depending upon specific needs. What are the components of an e-prescription? For an e-prescription to be legally valid, it must contain these details. Conformance ID of the system, used to create the prescription. Healthcare provider identifier, organization of the practice, or organization from which the prescription is issued. Unique prescription number for the prescription. Prescriber name, practice address, and telephone number. Date and time of issue. Patient's full name, including first and last name. Patient's address, or email address, or mobile phone number. Patient's date of birth. Name, strength, and form, and quantity of medicine. Adequate directions for use. Number of repeat supplies authorized, if any. Interval between any repeats. The authorization reference number and prescriber specialist qualification. What are the advantages of e-prescription? Transition from old-fashioned paper-based prescriptions to electronic prescriptions saves time and effort. Greater security is achieved when digital prescriptions are used instead of antiquated paper prescriptions. Errors caused by poor penmanship could be cut down. Time would be saved when there are fewer calls from the pharmacy regarding the clarification for scrawled instructions on paper prescription. Detailed information could be provided to the patient instantly about any possible contraindications and interactions with other drugs and OTC medications. How prescriptions are processed. A prescription may be handwritten on pre-printed prescription forms that have been compiled into pads or printed onto similar forms using a computer printer or even on plain paper, according to the situation. Prescriptions may be entered into an electronic medical record system and transmitted electronically to a pharmacy. In some cases, a prescription may be transmitted from the physician to the pharmacist orally by telephone. But this practice may increase the risk of medical error. In short, prescriptions are tricky to read and understood by a layman. Initially, even a pharmacist requires effort, and it is after extensive experience that he could read a prescription. This is due to swift writing of the busy physician and use of too many abbreviations, which could only be understood by a pharmacist. Although many of the Latin abbreviation are now out of the medicine and pharmacy curricula, but several are still in use today. Adoption of e-prescribing could bring positive outcomes, not only for healthcare professionals, but also for the patients. This would cut down handwriting-related errors, as well as lessen the need of in-office visits of the patients, just for refilling of prescription. In addition, it could also save time, as pharmacy could start filling the prescription when the patient is en route. That's all for now. We hope that you are finding our videos helpful. We welcome your suggestions and feedback. See ya!